guys, welcome back to Medical Coding with Blue. Today's episode is all about how to find your first job in medical coding in 2024. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if you have recently completed your medical billing and coding program, you've gotten certified, and now you are on the hunt for your first job, or maybe you finished your program but you haven't taken your test quite yet because maybe you need the money to take the test, so you want to find a job first. Well, so here are some suggestions. The first thing that I will say is this. When it comes to finding your first job in medical coding, the industry has a thing where they want everybody to have experience. And how do you magically have this experience if you've never been in the industry before and you just went to school for it? The thing about it is, guys, this field, health information, requires you to be tough. You cannot simply give up because you see everybody wants 3 to 5 years of experience. Everybody will ask for experience. And this is because there are many fast-paced, disgusting medical coding programs out there because they are rushing people through because they are just collecting all the money. And they sell the field of medical billing and coding, and they sell it to people who want to stay at home and work and raise their kids and all kinds of stuff, or all the money that you'll be able to make. What they're not telling you is that you need, especially if you're a brand new medical coder, it doesn't matter the reason that you want to work at home. The first job that you get, you want it to be around other medical coders, because the book coding and real world coding are two different things. So that you have to know. It's not going to be so drastic, but it is going to be different in terms of like the notes that you will see. Okay. So I always recommend to make sure that you are applying for places that you have to go in. But since the pandemic, there have been places that, okay, everybody works at home. So if you have to work at home as your first job, I mean, it is what it is. But here's the thing that I'm saying is this. When you're out there and you've passed your certification exam and you've gotten your certification, this already shows that you are competent to work in the field. So therefore, when you see these job listings that say candidate must have 3 to 4 years of experience, 3 to 5 years of experience, you're going to go ahead and apply anyway. And don't just look for entry-level positions, because that's another job destroyer thing for you to be able to find your first job, is looking for those magical words, entry-level, because everybody is looking for an entry-level position when they very first start. Little do they know you can start anywhere and it'll still be entry-level, because if there are happy coders in that area that are working currently, the employer in that area that needs medical coders is going to have to take who's ever applying. So they're not always going to get people who have experience. They can put out there on their wish list, hey, this is who we want. It doesn't necessarily mean that this is what they're going to get. And they do this because, like I said, they don't want to have to do the training that these shoddy schools have just pumped out these people and say, hey, these are medical coders because they passed the test. Because some schools teach you how to pass the test, but don't teach you how to critically think. That's why I tell y'all on my channel to get the workbooks that are in the description box below, so that you can continue to build your knowledge base and you can continue to study. So that way you can learn on your own, because you will be learning on your own. Okay? So you want to make sure that you are still applying anyway for jobs that are asking for experience, and not just pigeonholing yourself into entry level because you have no experience. Now let's talk about the resume, okay, along with this whole thing. The resume's importance cannot be stated enough. I talk about resumes all the time, and on my channel I've even done whole shows about resume tips for brand new medical coders. And for some people, they listen and it helps them, and they write to me later and they tell me that they were able to find their first job because they tweaked their resume based on what I had suggested and what I had told them in that video, and they were able to get a job with it. And so they're very excited. And then there's others that will copy and paste the resume for medical coders that's out there on the internet. I tell you what, if I was to see that as a hiring manager, your resume would immediately go into the trash and I would never give you a chance. because you're not doing your research on how to do your own resume. Anybody can do a resume, anybody. And you can write your own resume because nobody knows your experience and your skills better than you do, okay? And like I said, if you watch my video, and I'm going to leave that video link in the description box below, or you can look through my videos for the resume tips. But in that video, I talk about getting down to the basics. You don't have to qualify all of your skills like excellent ICD-10 CM. You don't have to do that. Just put ICD-10 CM on your skills, right? So you want to get your skills down to the brass knuckles, to the ones that they're asking for in that job listing, which most of the time is ICD-10 CM, CPT, HCPCS. If it's for an inpatient coding position, ICD-10 PCS will be on there as well. If you are not putting ICD-10 CM and you are just putting ICD-10, again, immediately in the trash. ICD-10 CM/PCS, immediately in the trash. Don't pass go, don't collect $200. It's literally in the trash because that's a details thing. And oh yes, you are being judged for your use of detail in your resume. So if you have a one-page resume, that's perfect, okay? I'm a resume writer myself. My rate and contact is in the description box below. But what I suggest is no more than 2 pages. If you are a brand new coder with no experience in the industry, just stick to 1 page. There's people on LinkedIn who are very proud of their resumes, but they are very upset because no one is calling them. And then when you look at their resume, it's because there's 3 to 4 to 5 pages. Employers do not have time to sit there and go through and look at all of your resumes, okay? And so they need somebody that's going to get to the point right away, tell them what they need to know. It's the meat of the potato right away. Not all of this, writing and, oh, I was excellent as a team player and organized, and that's all on your skills list. Again, that would go immediately in the trash because those are your soft skills. Those are your skills that everybody has when they're looking for a job. Doesn't matter if you're organized or not. You're going to say it because you want to get the job, right? But that's not the place for it on the resume. The resume needs to list the facts. ICD-10 CM, CPT, HCPCS, ICD-10 PCS, each one of them on their own line. Medical terminology, anatomy, pathophysiology. Those things need to be there because when you look at the job listings, that's the first thing they're asking for. Candidate must be proficient in medical terminology, anatomy, and patho. Everybody knows this. Okay, so we want to make sure that those are on your skills list. If the jobs that you have had, and you only need to go back 10 to 15 years, period. It doesn't matter if you worked in the 90s. It doesn't matter if you worked in the early 2000s. They don't care. And those things that you did back then are not going to be as relevant today as they would be, right? So you want to make sure that you're going back 10 to 15 years. It doesn't have to be your entire work history. If they need more than this, they will ask you. But again, we just want to make that brief, data-driven introduction, which is, hello, here I am. These are my skills that I learned in the school, because even though people say, well, Blue, I don't have experience. How can I put that as my skills? Because you were trained in it. You were trained in medical coding. So those are the things that you do have. Those are your skills now. You don't have to have experience in order to put those skills on your list. Okay? So make sure that you understand that. And if you are putting your jobs on there, right? And you have to think about what is transferable. What did you do at those jobs that would be transferable to medical billing and coding? If you worked as a cashier, you counted the drawer. So that means that you know basic math skills, right? You can put that onto your resume, and your resume under the job needs to be in bullets. It doesn't need to be a whole big old paragraph, because if I see a whole big old paragraph, I'm not reading it. Again, immediately in the trash. So before you set yourself up for failure, make sure that you're looking at your resume and it's down to 1 page, okay? And it does need to have an objective statement on it. The objective statement is going to say what position you're applying for. And do not tell me in the comments how so such and such says, no, I don't. Yes, you do. because these resumes often get printed out and go to the hiring manager. The hiring manager is looking at this, okay, well, we have several positions open in our organization. Which job is this? Which resume is this job for? Which resume is this for? And I don't know. And they're not going to go back through and look at your things and see what you're applying for. That's why it needs to be on the resume. So when you're applying to each different place and they have unique names, sometimes they'll say revenue cycle technician, medical records technician, medical records tech, medical coder, outpatient medical coder, inpatient medical coder, OP coder, IP coder, So they're going to have all different kinds of names. So whatever the name is that organization is calling their coder that you're applying for, you want that to be on your resume, okay? And they will reject you. They will say, oh, we're going to go with another candidate. They will interview you. They will say, well, we want somebody with more experience, wasting your time, which I don't think is right, but anyway, that's okay. Going on these interviews is going to give you more practice for the real thing, for when you do meet your forever family, right? For working. And when you go to these interviews, you can go in there with the mindset, hey, this may not work out or it may work out. I'm just going to give it my best shot. I'm going to do the best I can to try to get these people to give me a chance, okay? But what I am going to do is I am going to show my skill, even though I don't have experience yet, and they may want experience. But you know what? I have no bad habits, right? New medical coders don't have bad habits because they don't know, right? And they have recent training. You have recent training, and that's going to be a lot more appealing, because even as veteran coders can slip into their own ways of doing things. And, oh, yes, we do it this way at our facility, and we've always done it this way. You're adaptable as somebody that is new. So that is the best thing for some of these employers, because that's what they need, And as the field and the people who are working, the veterans that are working, as we age through the system, we are going to need people to fill in for when people start to retire. So you have to show the same strength as the people who came before you, because the people who came before you obviously did not give up till they found their first job, okay? I did not give up when I was out there looking for a job, and I got rejected quite a bit, okay? Now, I have said before, I have suggested, when you were out there looking for your first job, go to the temporary agency for medical professionals. You can Google it. There is no national brand that I recommend, because there really is none. But you go to Google and you say medical temporary agencies for medical professionals, and you will see a whole list of them pop up. Sometimes they're just hiring for nurses and for doctors and that kind of thing. But then you'll see other ones that say, well, we need medical coders, we need billers, we have a contract and things like that. So those are the ones that you want to get in touch with so that you can start to get connected with a job. Because every temporary assignment that you go on is going to be filler for your resume. And once you start having that experience for your resume, that's going to be the thing that's going to open the doors for you. But you have to be willing to go with those positions so that you can get started. And I will say this also. If you look at the starting salary, and some people have really written some nasty messages lately about, oh, the starting salary this. And I'm like, you think that's bad? I was like, wow, that's a really fantastic starting salary that you're being offered, and you're being a snob about it, to be honest with you. So if that's where you think that, oh, you're just going to start there, and, oh, well, that's just too low to start at, and you don't want to give it a chance so that you can build your skill, you're the one who's losing out. And you probably shouldn't be pursuing this field anyway, because of the simple fact that you're not going to start off at what you were making at a place where you are experienced, right? For example, for my nurses, some of these nurses, those are the ones that I get the messages from. Oh, it's too low. You're not going to make the same thing as you would make as a nurse, especially when you start out. Now, when you have experience and you move on, you start doing CDI and other things, yes, your pay is going to go up, and it is very good. But if you just turn your nose up to it immediately because it's not your nurse's pay, let's think about that for a second. When you started as a nurse, did you start out at that pay that you're currently at? No, you did not. You had to build up to that. It is the same thing for any other field, whether you're a surgical tech or any other business that you come into. You're going to have to start at a lower rate until you work your way up. That's just the way this industry is, and that's with anything. Okay, it's not just medical billing and coding. It's even people who start their own business that sometimes they don't make what they used to make in the first year. Okay, because they're really getting started and they're starting to learn. And this is when you're starting to grow. But then you see them a few years later, and when they are successful business owners, and then all of a sudden they're making exponentially more than what they made before. That's what it takes. But everybody wants this instant gratification. This is why you don't see me on TikTok. This is why I will never go on TikTok, because of that simple fact right there, is that is contributing to the shortened attention span and the instant gratification that people are having. They want people to get right to the point, right to the point. Guys, you have to have time to be able to build things up so that your brain can process and that you can have good decision making, and not just, here's the answer. This is what we want you to know. This is what we want you to know. I'm telling you guys, and if you start doing things that improves your attention span, like being more patient, that's going to help you so much more than I need everything instantly and I want it now. You will not get things right now. It's just like when you're out there looking for your first job. It will not happen right away for the majority of you. Now, some people who have been paying attention and who have been like, you know what, I'm going to have a plan. I got a strategy. I've been watching Medical Coding with Blue, and I see these tip videos about resumes, and I'm going to try to fix mine up, and I'm going to be proactive, and I'm going to be out there applying for jobs, even if they're asking for 3 to 5 years of experience, because I want my first job. Those are the people that get hired, not the people who stand around, I'm lost. When you already have somebody telling you, here's the direction. You get a good resume together, you apply anyway, and then you go on those interviews, even though you may think, well, maybe they won't hire me. Still go anyway, because that will help you to develop your professional communication, your professional skills when you're in there. And not only that, you'll be able to pick up on the subtle things that these employers are looking for. You know, you'll start to learn the lingo of the industry, like same-day surgeries and professional fee coding. So there's all these other things that you're going to be picking up when you're getting yourself around these people that are interviewing you. Okay, this is all about the shaping process. But I tell people, and I tell people, and I tell people, and I'm going to keep saying it. This is how you find your first job, is that you apply even though they're asking for experience. Because trust me, those places that are asking for experience and you're the only one who's showing up with no experience and there's nobody else to apply that has experience, they are going to reach out to you because they're going to be in a jam. They're like, you know what? This person was brave enough to come over here and send us their resume. Let's see what they got. And then when they send you that assessment test to test your skills and test your knowledge, and you do really well on it, then you're going to be part of that chorus that's going to show these employers that, yes, you should give new people a chance. Because there are good apples out there. There are good people that are trying to get their foot in the door. And they're not going to give up. And they're smart. They're intelligent. They apply themselves when it comes to learning. They don't have to be spoon-fed everything like a lot of these people do. And that's what's going to help build the industry up. Because again, when I was at conference and they were saying that when the ICD-10 CM came out and ICD-10 PCS, ICD-10 came out in 2015, that the average age of a medical coder in 2015 was 51. That was the average age of a medical coder in 2015 was 51. So you have to imagine now that, you know, we're all these years later, and a lot of these people are getting ready to retire or they're on their way out the door already. So we need to fill the industry with qualified, competent people. And just because you go through a shoddy program that didn't teach you and you feel frustrated, there's alternatives, guys. You can teach yourself. You can learn from the workbooks in the description box. You can get yourself a mentor. A mentor will help you for free. You can get yourself an account on LinkedIn. And you can put a request out there for, oh, does anybody know a good tutor, or can somebody mentor me? A mentor will do this to you, will help you for free, but a tutor you will have to pay. Now, guys, this is just a part of it. You have to pay tutors because they're giving you their time, their knowledge, their experience to help you in a one-on-one setting. So that deserves compensation, because if everybody just did whatever willy-nilly, I mean, that doesn't make sense, right? And so that's why you want to make forth the effort, and you have to be the one to dig in too. But if you're going to work with a tutor, make sure that you have those questions ready. Like, hey, I don't understand this modifier application. I don't understand the sequencing of, like, in this type of scenario, what happens here? Why is it sequenced this way? These are specific questions that you can ask that tutor. But again, guys, it's all on you. It is all on you. So you want to make sure that you are out there not listening to these people that are being negative and saying, oh no, the starting salary is too low and you can't do this and you can't do. Okay, guys, come on. You want to make sure that you're out there applying anyway, because the big layoff that just happened with that big company, somebody commented that it was 600 people that got laid off. Now, before you start panicking, because I know somebody just heard that and says, oh my God, all medical coders are getting laid off. No, just that company. They laid off people because it is typically a contract company, but they went through a furlough and they laid some of those people off. So sometimes these things happen, okay? Because it's not secure, right? It's not secure employment when it is contract. But these people were, had the rug pulled out from under them. But this doesn't happen everywhere, guys. There's still plenty of hospitals and facilities that need medical coders. So start at your local hospital and see if they have anything available for medical coding. They may call them medical records people, okay? So you want to make sure that you're in there actively looking at the different job listings. And then you want to see about the other places, nursing homes, dialysis centers. These people also need medical coders. Urgent care centers need medical coders. So optometrists, not really dentist's office, because it's typically the staff that does it at the dentist's office, but some people actually get in. So it really all depends, But then you're dealing with the CDT, and that's something completely different. So you want to stick with something like urgent care, or, other places like the dialysis centers and things like that, nursing homes. And look on those job listings so that way you can get out there and find your first job, because it is possible. But running around saying that you're looking for an entry-level job and complaining about the starting salary is never going to get you anywhere. That's just a big waste of time, because at the end of the day, all people are going to see you doing when you do something like that, complaining on LinkedIn. That's another thing before I wrap this up. Don't complain on LinkedIn. Don't tell people how hard it is, how you're looking for a job. Can somebody hire me? Please hire me. You can't do that, guys. You cannot do that. You have to be proactive, because at the end of the day, this is a very small field. This is a very small field. There's a lot of people that are connected to other people, and you're going to find that you're going to build a reputation for yourself. There are some people who claim that they know me, and they don't. They've never worked with me. I've never worked with them, but they sure have a lot to say. So people have to be aware that people are going to say whatever they want, but don't give them a reason if you start complaining about not being able to find a job or the starting pay is too low. Starting pay is not where you will stay. That is your starting pay. And I'm saying this for those people who want to turn their nose up to what the starting pay is. Now, if it was $10, then come on. Yes, I would be like, no, don't work for that, because that's just stupid, okay? Because you're trained, you have technical training. But if you look at the Department of Labor or the Bureau of Statistics, you will see what the average starting salary for a medical coder is in your area, okay? But again, guys, if you're pursuing it for that reason, you're in the wrong. Don't do it, because you will never be satisfied. You will always be chasing the money, and you don't want to have your career like that. You want to have your career based on you really love what you're doing. You want to do more. You want to learn more, and you want to be proactive and go out there and not get discouraged and help your providers so they can have good documentation for their patients, because at the end of the day, this is all about the patients and all about their medical records and everything else that goes in with it, because we affect a lot of people, and we have to be strong people ourselves, strong professionals, so that other people can benefit too. Okay, it's not just us that benefits from having a good, challenging career that's going to always keep us on our toes and interested, but it is the patients that will have accurate billing, accurate records, detailed records, because they the coder for that provider that they're seeing is top notch. And that's what you want, guys. That's what you want to be. But make sure that you're applying, guys. Apply, apply, apply. Even though they're asking for experience, I cannot say that enough. I'm going to put it on a t-shirt. Apply anyway. Apply for the job anyway, okay? Because you never know. All right, guys. With that said, I'm going to go ahead and wrap this one up. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.